Today we have Danielle Graves, did I get that right?
Mm-hmm.
With us to share about her job. Danielle, will you please introduce yourself and tell us what your title is at work?
Yeah, I'm a registered nurse in a small critical access hospital in Decorah, Iowa. It's about 25 beds, I believe. Yeah.
So what is your company like?
It's a small, kind of tight-knit hospital, not nearly as large as Mayo or Gunderson. We treat a lot of acute patients. A lot of the heavier stuff we will ship out. Yeah, it's kind of just a fast-paced, quick turnaround inpatient setting.
What does an acute, what does that mean?
Just more acute problems like sudden illness, surgeries, that sort of thing.
Neat. So what is the name of where you work again?
Winneshiek Medical Center.
And what makes Winneshiek unique?
It's unique in the aspect it's a county-owned hospital, so we have physicians both from Mayo and Gunderson. And so when you're an inpatient, if you get admitted to the hospital, you have your choice of whether you want a Gunderson doctor taking care of you or a Mayo doctor taking care of you. And sometimes that's beneficial for patients because they see the Gunderson doctors in Decorah, but then if they need to get admitted, they would have to go to La Crosse, where being a county hospital, we can see both sides of things. So we work with both health systems.
Danielle, what is your favorite part of working there?
I really like the small community aspect of it. I know a lot of people from various departments that our floor works with, such as therapy, respiratory therapy, the kitchen staff. It's just kind of a close-knit family type aspect. Also, you gain a lot of your skills. When I went to nursing school, I did clinicals in both a small and large hospital. And I really liked the rural small hospitals better because, at least to start, because you get a lot of your skills such as IV starts, catheters, that sort of thing.
Danielle, what does a registered nurse do at Winneshiek?
Well, it offers different areas of nursing. I'm a med-surg nurse, so I take care of patients that are admitted for any sort of illness on the med-surg floor. They also offer obstetrics care, so there's OB nurses, there's surgical nurses, clinic nurses. There's a lot of opportunities.
Sounds like a lot of different ways nurses can be involved and employed there. What are
Yeah.
some other career opportunities at Winneshiek?
There's the therapy department, so physical therapy, occupational therapy assistants, physical therapy assistants, respiratory therapy. There's of course the business aspect, the business office, financial stuff, scheduling patients, and then of course the physicians.
Can you tell me about some of the unique technology tools and equipment that your company uses?
Well, for nursing, I know we use a charting system called Epic, which is kind of neat. It's a computer system. It allows us to see if there's if they're from the Mayo side, we can see their outside records. If they're from the Gunderson side, we can see their outside records. We also have a telemetry on our unit, so that's monitoring of the heart. If there's any specific heart issues, we use that. We can monitor our patients from outside the rooms because we have cameras in the room, so we can kind of see, so we don't have to be in there 24/7.
What kind of training or education would you recommend for a student who wants to become an RN?
I would recommend getting your CNA. I know I got my CNA in high school, and that was really helpful to me. And then just choosing a nursing school, whether that be a 2-year school or a 4-year school. I know most facilities require a bachelor's degree. So for me, when I graduated high school, I wanted to get my bachelor's right away because I knew I would need it eventually. So yeah, just choosing a school basically that fits your needs.
Were there some high school classes you would recommend to students to take?
Yeah, anatomy and physiology was really helpful. It's not, I mean, some schools offer like a college level class, but even if it's not college level, it still really gets your foundation ready for what you're going to see in the college setting. Chemistry was helpful. A lot of the sciences were very helpful.
What do some entry-level positions look like at Winneshiek?
Well, you can get if you get your CNA, they hire CNAs. Even if you want to just start like in the kitchen, you don't really know you want to go into the medical field, but the kitchen is kind of a good aspect, whether that be at a nursing home or the hospital. I think you still get to see like kind of what happens there. They also offer like LPN positions in the clinic. Of course, most of them are full-time. So if you're going from LPN to RN, you don't probably want a full-time job, but they do offer that.
How does your company invest in employees?
I feel like they're really good about scheduling it around your life, at least what I've found. They also offer like benefits for both full and part-time employees. Of course, your PTO accrual, and then since it's county, it's a state thing. So Iowa has IPERS pension, which is a good like retirement pension.
If a student is interested in getting more information from you, how could they reach you?
They could email me.
Awesome. What else do you think students should know about your position?
I just would encourage students to look, if they're thinking about going for their RN, to look for schools that do clinicals at various different sites. That's something I didn't realize how helpful it was. Thankfully, I went to Luther College and they do clinicals at a nursing home. They do them in Decorah at the Winneshiek Medical Center. And then we spend a year at Mayo Clinic. And I feel like it really like diversifies your experiences versus some schools that only pick one site to go to.
Great advice. What would you tell your 18-year-old self?
Um, I don't really think I've always wanted to be a nurse, so for me it was kind of a easy decision of what I wanted to do, but I just would encourage people to explore their options, really look into things. And I know there's a lot of pressure on going to school right away, but if you really don't know what to do, I think it's best to just like explore your options and look for what you really think you're gonna like.
Thank you, Danielle, so very much for your time today.
You're welcome.